Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette Siragusa, Chief Nursing Officer and Provincial Lead of Health System Integration and Quality for Shared Health. To protect Manitobans and to halt the spread of COVID-19, Public Health is announcing today that Southern Health, Santé Sud, region is moving to critical or level red on the pandemic response system. We've been messaging to Manitobans for quite some time about the importance of the fundamentals and to reduce their contacts. But as we can see, our cases have gone in the wrong direction. We're seeing more cases, more strain in the healthcare system, and so further action is required. And so at this critical level, or red, on the pandemic response system, the following restrictions will be coming into force on Monday. All restaurants and bars will be closed to in-person dining. Takeout, drive-through, and delivery will be allowed. Capacity at cultural or religious gatherings will be reduced to 15% or 100 people, whichever is lower. Grocery stores and pharmacies will continue at their current 50% capacity. And so there's no changes in that capacity to reduce the impact on food security and to avoid unnecessary stockpiling. All other retail will be reduced to 25% or 5 people, whichever is higher. These limits do not include employees in the calculations. But again, we recommend to all households to reduce your time outside your house. So if possible, send only one person for essential errands. All recreational facilities, indoor and outdoor sports facilities will be closed. Gyms and fitness centers will see their capacity reduced to 25%, and masks are mandatory even while exercising. VLTs and other gaming establishments will be closed. It's the intent that these new orders will halt the spread of the virus, the decrease of transmission of the virus in the community. We're encouraging businesses in Southern Health Santé Sud region to have staff work from home whenever possible, and for residents to stay home as much as possible. So certainly if you are ill, we want you to stay home, and the messaging is the same as we have right now in Winnipeg metropolitan region. If you or a member of your home is ill, we want you to be self-isolating pending results of a COVID test. So we need to act now to reduce our number of contacts. This is achieved by staying home as much as possible, leaving for essential reasons only. Avoid socializing outside of your household. Thinking about when you do go out, especially a weekend coming on, is do you need to go out? Is it an essential reason why you're going out? Or is it just a natural desire to go out? We need to focus on leaving just for those essential reasons in the short term. Remember, it's not going to be like this forever. But right now we need to make this change to dramatically decrease the transmission of this virus. And so we know these concrete steps. We know they work. They've worked before for us. They'll work again for us. But we just got to get back on track. As the pandemic has progressed, we've seen increasing demands worldwide on the finite resources available for testing, and Manitoba is no different. You've seen our testing capacity dramatically increase from the first wave, and we're seeing quite high numbers of tests being done in Manitoba at this point. But again, we need to ensure this finite resource is used appropriately. So we are maintaining our message to people that if you are asymptomatic, or if you do not have symptoms of COVID, we do not want you presenting for testing. You know, of course, if you've been advised to go for testing by public health, then certainly follow that advice. But for the most part, people who are not experiencing symptoms, what we call asymptomatic, please do not attend for testing. People who are not experiencing symptoms, will not be able to book an appointment for testing. And people who are presenting without symptoms or a referral from public health may be turned away from our test sites. We really need to focus on symptomatic people at this point. So please, if you're not experiencing symptoms, unless you've been referred or advised to go for testing, please do not attend our test sites. Yesterday, the Premier announced additional public health enforcement powers, which will be granted to additional personnel across the province to help enforce the public health orders. And again, the public health approach right from the beginning was to educate Manitobans, to advise on the things that we need to do to limit the transmission of the virus. But at this point, at such a critical juncture, where we need these public health orders adhered to, we've had to step up our enforcement. We know that for the most part, Manitobans have been on board right from the beginning. But we know the way this virus transmits, it doesn't take many to lose sight of the importance of the pandemic to affect us all. So we need to ramp up that enforcement, and we're doing so. And along the same lines as the public health order, it's somewhat frustrating over time, and especially right now, where we get calls in or informed of businesses trying to work around the orders, or to try to interpret the orders in a way that's obviously outside of the spirit of the orders. Right now, no one should be looking for ways for Manitobans to gather. Right? This is what we need. We know this virus spreads indoor places where people are gathering. And these orders, the restrictions on group sizes, the restrictions on occupancy are there for a reason. So please understand the spirit of these orders is that we have to reduce the ability of Manitobans to gather outside their homes. And so we know it's tough. There's businesses that much of their model is based on gathering. And so this pandemic has been tough on everyone, but especially tough on people who work in or who own businesses that are based on gathering. We know that's challenging, but we must maintain our healthcare system. We can see that strain on the healthcare system now. We need to decrease the transmission of this virus. So no one should be looking for ways to try to gather more Manitobans. Right now, and again, relatively short period of time, we have to just get on top of it. We will get back to normal at some point, but right now we need to focus on not finding ways of Manitobans to gather outside their home. So please work within the spirits of the order. It's vital that we interrupt the spread of this virus right now. We talk about self-isolation. And you've heard some updated advice that if you or someone in your home is experiencing symptoms of COVID, then to stay home, to self-isolate pending results of that symptomatic person. And self-isolation has been a major part of our strategy right from the beginning. And again, the reason why we isolate people, cases or contacts, is to limit the amount of spread. Limit the amount of people who are in contact with either their case or that contact. So if you are a contact and you're notified by public health to self-isolate, should you become a case, and we know a certain proportion of those people do become a case, the idea is that you should have zero contacts. There's no one you could have passed that to because you've been self-isolating. That way we eliminate really the transmission of that virus any further. So when in your home, if you're required to self-isolate, that means self-isolating even from people within your own home. It means using a different washroom if possible, not being in common areas with other people in the house, wearing a mask if you end up needing to. And of course, we realize this is not a possibility for certain Manitobans, and so that's understandable. But for many, they can successfully, completely self-isolate within their home. For others, they could attend our alternate isolation accommodations to do that. And for others, they may not be able to completely isolate from others, but they can take steps to reduce the amount of spread within their home. So we need to ensure when we're advised to self-isolate, we're doing so appropriately, doing so to the best ability of the circumstances that we have. Again, noting that essential workers who are required to wear medical grade PPE, such as our healthcare providers, first responders, and they don't have symptoms, they're exempt from our recommendations to stay home if anyone else in your family was ill. This is because we obviously need these essential services to continue, and they'll be wearing appropriate medical grade PPE at work, limiting the concern to others. Certainly those essential workers with symptoms need to stay home until results of their testing. And cases will obviously be notified by public health, and you'll be required to self-isolate until advised no longer to, which is going to be at least 10 days after the onset of symptoms, sometimes more. Contacts of cases need to self-isolate for 14 days on the advice of public health. We are advising of 5 deaths due to COVID-19, reporting today. A female in her 40s from the Northern Health Region, a female in her 60s from Interlake Eastern Region, a male in his 90s from Winnipeg Region and linked to the outbreak at Maples, a male in his 90s from Winnipeg Region linked to the outbreak at Victoria General Hospital, a female in her 90s from the Winnipeg region, also linked to the outbreak at the Victoria General Hospital. And to extend my condolences to families and loved ones of these people, as well as other deaths that we reported earlier in the week. The 5-day test positivity rate is 9.1%, 243 new cases of the virus identified as of 9:30 a.m. There was one data correction, so we have a net of 242 total lab confirmed cases, and taking our total to 7,419. Some updates on our outbreaks. Parkview Place has a total of 147 cases, 36 staff, 111 residents, and 23 deaths. Maples Personal Care Home has a total of 176 cases, 55 staff, 121 residents, with 9 deaths. Victoria General Hospital has a total of 67, which include 34 staff, 33 residents, and 5 deaths. And Headingley Correctional Center has a total of 141 cases, 29 staff, 112 inmates. So we can see it's clear that our numbers, the number of outbreaks in various facilities is going in the wrong direction, and that's why we've moved on these restrictions, and we'll continue to evaluate things and act accordingly. We need these restrictions in place to change the trajectory, to change that behavior that we've seen that has led to transmission of the virus. We need to reduce that burden on the healthcare system. We're talking about focusing on the fundamentals, staying home if you're ill, now staying home if anyone in your home is ill pending results of that ill person. Hand washing, sanitization, physical distancing at all times when you're outside your household, wearing a mask indoor public places. And really, right now it's about reducing the amount of contacts you have outside your house. And that can best be accomplished by staying home and leaving for essential reasons, sending one person out for essential reasons, certainly to avoid crowded places, avoid closed-in, poorly ventilated places, really avoid socializing outside your household at this point. Again, very difficult, very challenging. We've done it before, but it's going to be a short term. We're going to see these numbers turn around. We may not be back to normal in the near future, but we will be able to remove some of these restrictions as we see our numbers improving. And so all this messaging is even more important to people who are high risk of severe outcomes, those over age 60, those with underlying medical conditions, those with immune compromise. Really need to focus on staying home, but for essential reasons. Protect yourself, limit your contact with others, let us get this, the community transmission down, but please plan to stay home as much as possible, leaving only for those essential reasons. So thank you, and I'll turn it over to Lanette.
Thank you very much. Good afternoon. As of 8:30 this morning, our critical care baseline of beds is now 83 in use. 78 of those beds are filled with patients, which makes us at a 94% occupancy rate. 20 of those patients are COVID related. 15 patients are on ventilators this morning. We did add 3 ICU beds in the system over the past couple of days. 2 of them were in Winnipeg and 1 in Brandon. Over the past week, 6 beds have been added to critical care. Since October 26th, 333 non-urgent and elective surgeries have been postponed as part of our slowdown. 159 of those were at St. Boniface Hospital. Medicine beds, meanwhile, were about at 80% capacity this morning in Winnipeg and slightly lower capacity, around 75% in rural and northern Manitoba. Acute care hospital capacity will continue to be increased in stages as needed to respond to the health system's needs as part of our overall planning. We have been preparing since the spring to respond to this current scenario that we are now facing, and we are getting ready for the surge and the increased numbers. There has been considerable planning to identify space, equipment, and supplies across our province to support this surge in activity, both in medicine and critical care. We have ordered and are storing a significant amount of supplies, equipment, and personal protective equipment to support our ability to expand capacity as the need requires. Our biggest area of work at this point of time is staff planning. While we have the space, equipment, and supplies, any planning amidst a pandemic is going to be challenged by maintaining appropriate staffing to provide safe patient care, especially when physicians and staff themselves are susceptible to the illness or are required to self-isolate. We know this is a reality in the pandemic across the world, and it's not unexpected, and we have been planning for this. Our plan, therefore, looks at all healthcare professionals, not just physicians and nurses, but also allied health and support staff, anyone who provides direct care, but also those who support those who provide direct care. So we're looking at facility management, infection prevention and control, staff health. They are all key in helping our workforce, helping our staff do what they need to do. Within the various phases of our plan, there will be different demands and requirements for staff. To support the expansion of beds, we have been breaking down the tasks that are associated with patient care and identifying and detailing the scope of practice for all our healthcare professionals. There are 4 pillars that we've taken to planning this surge capacity, and they include space, equipment, supplies, and staffing. On the space end, we've identified additional space for our critical care and medicine units, allowing us to incrementally and gradually expand the number of critical care and medicine beds within our system in 3 phases. If needed, we will have the ability to increase ICU beds by 143, while increasing the number of medicine beds we have in the system by more than 1,000. Keep in mind, though, that this plan does include various factors and will be responsive to a variety of changing and dynamic considerations. We have planned to escalate capacity in gradual phases, and the magnitude and duration of the escalation will be in proportion to the number of active cases that we're seeing in the province. The plan is based on principles, and it is not intended to be rigid or static, but rather evolve as needed with each identified phase, and learn as we go and get better as we go. Many of the new inpatient spaces for ICU beds will be found from reopening closed spaces in the hospitals that were previously critical care units. The repurposed spots are primarily surgical or cardiac inpatient recovery rooms. And the majority of the repurposed medical beds, meanwhile, will be found in surgery inpatient units that have been freed up by the current slowdown in surgical activity. In the event of an extreme surge, we also have plans to establish a low acuity overflow site, more than one if need be, that will provide space to care for patients who are in hospital but have lower acuity needs and can be in a non-hospital environment with support from healthcare professionals. Equipment. So to support these new patient care spaces, we have acquired more than enough equipment to do what we need to do in those spaces. We've nearly doubled our available ventilators, and we have purchased other equipment that is required for this fight, including EKG monitors and infusion pumps and oxygen concentrators and lots of beds. The availability of PPE for our staff remains a very high priority and is something that we will continue to monitor closely throughout this entire pandemic. The challenges that we had in the spring with supply chains and vendors have mostly been alleviated for now. And at this moment, we have at least 90 days worth of virtually all types of PPE on hand, including gloves, gowns, face shields, eyewear protection, and most N95 masks, although for the size small N95 masks, we have currently a 53-day supply, not including the 30-day supply that's out in the regions right now. More orders are being made every day to further bolster our stockpile, with shipments arriving every day. And we also have seen some progress with a local manufacturer with regards to reprocessed N95s. So we have a few more details to work out on that front, but our hope is that we will soon be in a position to share more details, which will help us be stable long-term in terms of N95s. We are confident that we have the space, the equipment, and the supplies that are necessary to manage the patient surge that we are anticipating. The staffing plan is underway, and actions are being taken to mobilize teams. As I have previously mentioned, our planning is founded on the creation of team-based models of care to safely manage patient care across an expanded bed base. We have experienced and specialized staff working in critical care, medicine, surgery, and ambulatory care. And we will start by working with these existing teams, as well as adding new individuals, former and future staff from all health professions. We've identified staff from specialized training who are working across the province, and we have put out the call to former staff with specific skill sets, including 405 individuals who have been hired through our COVID-19 casual pool since April. Since our renewed call, that happened October 17th, people have been hired into this pool, and including 35 nurses. So I just want to say to the healthcare workers out there that I have complete confidence that you have the skills and the competencies to do what we need, that you are very valuable as we look at how we're going to manage this pandemic. But I also appreciate that you are all human beings, and you may be parents or caregivers, and you're individuals. And so if and when, as I say, we're going to do this gradually, and we're going to do it on an as-needed basis. But if the time ever comes where we need staff to come and help us with this pandemic and move into a different area, we will be very respectful of each individual and your competencies, and we want to work with you, and we want to support you however we can. And we know it's a really big ask, and we're thankful for you. We'll follow the right process, and we will respect you as people who have special skills needed at this time. We also have started working with educational institutions. We have more than 6,000 students who are doing clinical placement in Manitoba at any given time. These are learners who are at different stages in their academic requirements, but they do need to have clinical placements. We do need to help put them in a place that they can learn the skills and also feel safe and supported as well. So we are working with how do we place the students, and potentially some of them might be able to help us in certain ways as well. And we have received guidance from the 23 regulatory bodies since the spring to help us develop this team model of care. Work has begun to break down the care needs of a patient and to identify tasks that must be done by the most specialized members of the team. And the intent is to identify clear roles and responsibilities within the teams. So giving tasks to team members based on their scope of practice, and reserving the most specialized providers for tasks that only they can do. As the number of surgeries performed starts to slow down, we are preparing to move surgical nurses to both ICU and medicine to begin just some familiarization and buddying to get orientated in case we need them. As for physicians, all will be asked to contribute as part of our response. Physicians and clinical assistants are part of our plan, and they are a very valuable group that we hope to be able to work with. And we've extended beyond the normal facility-based the facility-based physicians by also reaching out to the community and the primary care physicians. So right now at this point, we have had about 100 physicians who have indicated that they are interested in receiving orientation to enable them to support care in various settings. So we're very thankful for that. Meanwhile, there will be staff asked to assist in other areas. For example, 15 people started training today to assist with contact tracing. These individuals are a combination of nurses and medical residents, and we're glad to have them on the team. So this is a phased and incremental approach. This planning is not rigid and it is not set in stone, and it involves local and site-based input for sure, with provincial support to manage the challenges ahead. So the plan will evolve. It will continue to get better. We're going to learn as we go, and we expect that a plan of this magnitude is not going to be without some bumps in the road. But we are very confident in the skills and the professionalism and the dedication of each and every one of our staff, our healthcare workers, our physicians, our nurses, our allied health, and our support staff, who have stepped forward during these unprecedented times. We literally could not do it without you. So finally, for everyone who is working in the healthcare system, your voices are always important, but especially so right now. We are doing everything possible to minimize disruption and support you well. We expect these bumps are going to be in front of us and we're going to get over them. And while we do, though, we really do value your feedback and your suggestions on how we could do better through this process. We, healthcare workers, are natural problem solvers and leaders and change makers. And we need to rise together to this challenge, and we want to do it together. So for all Manitobans, beyond the healthcare workers, this plan does expand into the system's capacity dramatically in order to provide a safety valve for the high number of daily cases that we're seeing. The healthcare, the acute care hospitals are not a replacement for the public health principles that have proven to work, and we need to follow right now. We need to cut down on the number of contacts we have. We need to physically distance. We need to wash our hands and wear our masks, and we need to get our flu shot, and we need to stay home when we're sick. By working together, the healthcare teams, the public, we are going to get through this. So I just thank everybody for being with us during this time. It's unprecedented, but it's not going to last forever. We'll get through it. Thank you. And with that, we can open to questions.
Thank you. A reminder to our reporters on the phone, you have one preliminary and two follow-up questions this afternoon. Up first from CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, previously you've mentioned that there was COVID-19 spread at faith-based events. Can you tell us which events took place and how many people have contracted COVID-19 as a result of these?
No, we don't disclose unless there was a reason to disclose the specific situation, but there's been a number of, if we talk faith-based, so just regular faith-based gatherings, certainly in weddings and funerals we've seen. So there's multiple examples, and we've been able to contact trace in those, and if there was a reason we needed to announce the specific location, then we would.
Are you able to share a rough idea of how many? Is it in the tens?
Of different type of events?
Yeah.
Yeah. I mean, it's multiple. If we talk about if we add sort of weddings and funerals and religious events, it's much more than 10.
Okay. And we're also aware that some people in the Southern Health Region are strongly opposed to COVID-19 restrictions. What messages do you have for people who don't want to follow the new red restrictions?
Yeah, I mean, I think it's we've always acknowledged, and I think it's clear that the restrictions are difficult. In fact, we need the restrictions based exactly on that, right? Just asking people to do these difficult things that hasn't worked. The only way we can get them fully followed, especially very challenging ones, are to put these orders in place. So I would say, look really at the numbers. Look at the numbers that we saw in summer. Look at the numbers we saw in the spring, and look at what we see now. 160 cases in the spring would have been quite alarming. We have 160 people in hospital right now. So this is real. We need to make a change right now. And so everyone certainly acknowledges that these restrictions are difficult. We want to leave them on for the shortest amount of time necessary. We want to leave them at the least restrictive means necessary to make a change. But I think it should be very, very clear that we need a change right now. So I'm really asking Manitoba to step up in the short term so that we can really make a difference in the transmission of this virus.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, my first question is for you. The Free Press has been told that the province is not informing schools about a COVID exposure if it's been over 14 days since it happened. Why isn't the province being transparent with families about all school exposures?
Yeah, I don't know about necessarily the details on that. Public health, certainly if something is 14 days already past the time the incubation period is over. So we're talking about finite public health resources. We're not getting much benefit from that. I would suggest that that's a very rare occasion that we would find out an exposure 2 weeks or more after it occurred. Transparency. I think we list a number of school-based exposures. We send out letters. Public health spends a lot of time on the school-based cases. So I don't think there should be any concern about transparency. I think we've been very transparent from the beginning. Even early on, the level of transparency, people were quite critical of our level of transparency. I'm not concerned about transparency at all. We've disclosed a lot of information about schools, and we'll continue to keep people informed.
Thank you very much for that. And we heard earlier today, and this question is probably for Nurse Siragusa, we heard earlier today about the province's plan to increase hospital capacity incrementally. Can you please explain again how fast, new wards or beds can be opened when you decide it's needed, and why mass capacity isn't, open and waiting for patients today?
Mm-hmm. So we have, I guess, we'll start with your first question. How quickly can we do it? It is gradual, so we are able to move and build that capacity, I would say, probably within days, actually. And depending on how much we need and where they're going, if it's medicine or critical care. But we know we have everything we need. We have the space mapped out, and as we need to, we will shift and move patients and bring those supplies on board. So we've done it already a little bit, as you know, this week, and we will continue as patients are admitted to hospital. So days to weeks, I would say. In answer to your question about the low acuity space, well, that would be the last phase that we would look at when we've pretty much exhausted the hospital capacity or are getting close to it. So our goal here is to always stay a couple steps ahead of the cases coming into acute care. So we probably would need a few weeks in order to set up that low acuity space, and we're not there yet. But we'll carefully monitor the situation. It is a gradual situation, so it's not the same as if there was a mass casualty situation and everybody came in at once. They're going to come in gradually over days, and so that's how we're going to manage this. That's how we're going to manage our staff and building bed capacity and expanded capacity beyond the hospitals.
Thanks so much. And just in the short term, how many beds, either in medicine or maybe medicine and ICU, are you prepared to open in the next 7 to 10 days?
As many as we need to.
From Global, Brittany.
Good afternoon, Dr. Roussin and Ms. Siragusa. Lanette, when we spoke a little bit earlier, we were talking a bit more about the staffing and the team staffing. Could you explain a little bit about what that is like for a critical care nurse to patient right now, and what that would mean when you have to move towards that team staffing.
Sure. So right now, critical care nurse goes through special training, takes them months to go through the training, and just like any of our healthcare professionals working on a specific unit with a specific patient population, you gain expertise and skills, not just from the training part, but just from learning and knowing and seeing every day. So right now, our critical care nurses, for the most part, they have one critical care nurse who takes care of one patient. So we call that a one-to-one ratio, nurse to patient ratio. In a pandemic situation, if we have to expand our critical care beds, by 100, let's say, then it will be gradual, but we have to look at, we are not going to have 100 extra critical care nurses trained and prepared, and nor do we have to. So the critical care team is looking at, and they're looking provincial, but there is a critical care team, a medicine team, and a surgery team who are looking at how do you work as a team to make sure that patient in critical care gets the best care they can. And there's other healthcare professionals who have skills. In fact, there's a lot of overlapping skills between nursing and pharmacy and physiotherapy and other professions. So an example that they probably would look at first in critical care is a team of a critical care nurse who would oversee, because they have the experience and the training, would oversee everything, but there would be maybe a physiotherapist on the team. And the physiotherapist some of them have experience with breath sounds and managing pulmonary issues. They can read lab values, they can monitor intake and output. So physiotherapist, a pharmacist, often when you're in critical care, you need a lot of medications, and so they can help with the preparation and potentially the administration, so we'll have to work with the scope of practice. And the other position might be a rehab assistant who can help with positioning and supporting the team in general, but the patient specifically. So if a critical care nurse who was once one-to-one with a nurse to a patient now has this support around her and the patient's needs are supported in different ways, it allows that this team can take care of more than one patient. So that is how we're looking at it, and and there's other ways we can support that team as we go. And that's one example of a model, but there could be different models as well.
Thank you. And when we look at the hospitalizations and ICU numbers that get released daily, today we're seeing 20 patients that are in the ICU. We're hearing that the infection prevention control team is actually overwhelmed and behind in being able to report numbers to the province. Is that a concern to you? Have you heard the same thing? And how are you addressing those bottlenecks? Because we've heard there's actually 30 patients in ICU.
No, I haven't. I do receive emails regularly from the infection prevention and control team. They are busy, absolutely. They are assessing every situation, if it is an outbreak or if it's not an outbreak, and they're also helping to manage where patients are cohorted and supporting the staff in terms of recommendations for testing or isolation or PPE. I have not heard inaccuracies in the counts, but I can look into that, Brittany.
Great, thank you. And my last question is, the three-phase plan that is being rolled out or that's being discussed today, those plans have been in the works since the spring, you've both said. How have those plans changed since the spring, and seeing what our numbers were then and seeing how quickly our numbers are increasing now? What have you had to change, if anything, to get this plan implemented, and what are you looking at in the rollout?
Yeah, so we haven't made any dramatic changes. We actually made it in the spring expecting this situation was going to happen then. So it was based on evidence. It was based on looking at what other jurisdictions do in terms of how they use their healthcare professionals and support staff. So we continue to update the evidence. We've recently had a conversation with the regulators, and they gave us some feedback that we are tweaking it slightly. Over the summertime, the regions really did some work on looking at what professionals were working in their geographic space and how they could reassign them accordingly. So it's really been just refining it. It hasn't been drastic changes.
From the Brandon Sun, Emily.
Good afternoon. I guess my question is for Ms. Siragusa. As was discussed earlier in our technical briefing, but brought up again here, out of all of the personal protective equipment in the province, we have the smallest amount of small N95 masks. With this in mind, will they begin rationing small N95 masks at the Brandon Regional Health Center or other facilities across the province?
Yeah, that is not my understanding. I believe that our logistics team continues to find the N95. So although the stock isn't as plentiful as the rest of the PPE, there still are vendors out there, and so they're still pursuing. So at this point, we are not putting any restrictions on. We're going to keep using what we have, but we are looking at alternatives too as well. So they're always looking at different vendors and how we can bring more in.
My follow-up is, could you provide, if possible, a bit more detail about the acute patient overflow facilities that are being looked at, looking at non-COVID patients being moved outside of the hospital? Would you be able to provide more information about the types of facilities that those might be located in, and where those beds might be located between Winnipeg and Brandon?
Mm-hmm. So different spaces have been explored if we get to this phase, and I hope we don't get to this phase. So we're continuing to watch the numbers and monitor it closely as to when we would have to trigger this response. But if we needed to get to a low acuity center, and we can have multiple of them, it doesn't need to be one, but it's really a matter of finding the appropriate space. It would be a large space where we could put multiple people in, and it would be low acuity patients. We often have low acuity patients in our hospitals who are waiting to go to placement or waiting for home care to get set up. So it would be more this type of patient where they don't necessarily need acute care. They need to maybe have some support in terms of healthcare worker support. But they would be safe, they would be stable, but they would be in a location like that where it would be up to 100 people, potentially, depending on the size of the facility. And it could be in Winnipeg, or it could be beyond in rural, potentially Brandon.
Okay, thank you.
Thank you.
From CJOB, Clay.
Hey, good afternoon. So it looks like the health officials are expecting another surge. Is there any projections on how bad the numbers could be if the current restrictions just aren't working?
Yeah, and so again, when we look at models, we see a large range in outcomes, and so certainly with the numbers that we saw, trending up last week, and then into this week, if they went unchecked, then we're looking at significant strains on the healthcare system by the end of November, early December. And so that's why we were required to act now and act with quite aggressive restrictions, because we knew we couldn't allow that trend to continue.
Do the plans that are currently in place to deal with whatever comes down the road, does that include a possible surge in flu cases on top of COVID-19?
Well, we planned for as many beds as we can, and so yes, it would have to include the flu patients. And we are hoping, though, that the restrictions that are put in for COVID will be equally as effective for influenza, including the flu shot that everyone should go for.
All right. Thank you both.
From the Winnipeg Sun, Scott.
Good afternoon to you both, Scott Bilk, Winnipeg Sun. First question for Dr. Roussin. The messaging is trying to get a grasp on the messaging here. Everybody's supposed to stay home, limit contacts. Yeah, kids are still allowed to go to school. I know you say there's not in-school transmission, but why not just take that precaution there? And also, why not just not allow faith-based organizations to gather? 100 people seems like a lot, even if you can cohort and do all that stuff. Why have these risks still, or you called it the balance, I suppose, in the past? Why still have that in a time where you called it vital for people to essentially stay home?
Mm-hmm. Yeah, and so a couple of questions there. So with schools, again, so we've seen lots of cases in schools. Again, from the community, we're not seeing evidence of a lot of transmission within schools, which is reassuring at this point. Of course, the more and more cases introduced, the more opportunity for transmission. So that's why we're putting in a lot of restrictions. It is that balance and what is important. And so we hear a lot of concerns about the restrictions that the restrictions cause a lot of concern to people, but it's also what do we want to keep going? What's important to us? And so is that important to us to continue with school, to have the kids in school in that environment? And I think that is. And so we're going to do whatever we can to keep the kids in school, obviously safely. And by putting on the other restrictions, we're going to limit the amount of community-based transmission and limit the amount of cases further introduced into schools. But we know now, despite the amount of cases introduced, that's not translating into a lot of transmission within the schools, which means a lot of the precautions are being followed. As far as faith-based organizations, again, it's certainly going forward, all of our restrictions are about reducing gathering. And so any place where people gather indoors prolonged is a risk. So we've dramatically decreased the capacity. Remember, it's 15% of max capacity, and so you could only gather 100 people if that equaled 15% of their capacity or more. So it's dramatically declined. And again, why do we have it? Well, we've started with that because we've heard of how beneficial it is to many Manitobans. We know the mental health issues of these restrictions. And so we're doing whatever we can to have the least restrictive restrictions in place to still get our outcome. Now, it's still something that we continue to look at because, if we see ongoing transmission, if we're not getting the results really quick on, then that might be something we have to get back to, again, for a very short period of time. But it is something that we're continually looking at.
Thank you. First follow-up also for you. Can you confirm that public inspectors have gone into Maple's personal care home?
I can't confirm that. I know that we have processes in place to inspect, to investigate these outbreaks. Certainly the regions involved, regional public health, and in a number of other areas. But I can't confirm that. I don't have a detail on that.
Okay, and final question for Lanette. And when you talked about it in the technical briefing that stuff isn't attributable, so I'll ask you here as well. Have nurses been consulted on this redeployment, and when will that happen to see, if nurses are even on board with, going into, different specialties and that sort of thing that they may or may not be comfortable with.
That's a good question, Scott. So at this time, we're really just looking at where is our workforce if and when we need to deploy them. At this point, we haven't approached, the ones who will be moving will be approached personally. There are labor relations issues, obviously, that have to be worked through, and we want to follow that process. And we will have individual conversations as the needs arise, as the beds expand, or hopefully not. So it'll be an ongoing conversation throughout this pandemic.
From CBC Radio Canada, Amelie.
Hello. Hi there, Amelie from Radio Canada. Just wondering if you had any breakdown on the age of the person who are in hospital right now and in intensive care as well.
Oh, I did not bring that with me, but I certainly can get that for you. I will ask to loop back with you on that question.
Okay. And do you have also the number of beds occupied in acute care at the moment by COVID patients?
Yes, we do. I think you have that on your list, 100 and...
This is in the
dashboard.
Healthcare facilities, or how many that are admitted right now? Or are you talking about how many people are currently admitted to hospital?
Patients with COVID, in beds, acute care,
Acute care.
Right, yeah, so it's 161 currently admitted and 20 of which are in ICU.
ICU, okay, that's right. And just to come back on the plan presented this morning, we heard from different healthcare professionals that although they were happy to see that plan, they think that it might be too late, and their principal concern is human resources and especially skilled professionals to help prevent the spread of the virus. What would you answer to them?
Yeah, it's a bit of a science, actually. So we have been recruiting as many people as we can throughout the pandemic since April. There are many demands on the system, and I know you know that, whether it's the public health nurses with contact tracing or health links. And certainly we have been looking at acute care, but there was also the need to continue on with surgery and get some surgeries caught up, which we were able to do over the summer. So between recruiting, between partnerships with some organizations, and we didn't want to cut services. We will only do that if we have to. But if we have to, then we free up quite a bit of staff. And it's not just the staff, actually. It's the beds, too, that we need, the physical capacity. So it's a bit of a balance. And we certainly have not in any way slowed down hiring. We've done as much as we can to hire new people, and we're not going to stop. So if there's anyone out there who is interested in helping with this pandemic, there certainly are positions out there in so many different areas that there's a place for everyone who wants to help.
From CBC Manitoba, Bart.
Hi, Ms. Siragusa. What is the plan to contend with inevitable infections with doctors, nurses, and other healthcare workers as hospitalization numbers of COVID patients increase?
I didn't hear the beginning. Can you repeat that? Sorry, Bartley, you cut out in the beginning.
Forgive me. What is the plan to deal with the inevitable infections of doctors, nurses, and other healthcare workers in hospitals as the COVID patient numbers increase?
Well, we are looking at IPNC audits. We are looking at continuing education. We want to support our staff, but you know what? It's I'm not going to lie, it's a challenge that we face. It's a challenge that every hospital in the world right now is facing. So we are going to manage the best we can. We are going to support each other and move people where we need to move them to get the work done. Again, I've always said we work at a local level, so as much as possible within a hospital or a personal care home, they manage within the confines that they have. When they need help, they escalate it to a regional level or a provincial level. So depending on the magnitude of the impact, we will figure it out as a province. And we have some preventative things we can do as well, and we will do that.
And forgive me if these are repeat questions from the briefing earlier, but why not arrange with provinces that are less affected by COVID, such as the Maritime provinces, to move some experienced ICU nurses into place here?
Well, we certainly could do that, Bartley. It's not out of the question. It's just not necessary at this exact moment. So that might be something we're talking about down the line, but it's not something that we're acting on at this moment.
All right. Thank you very much for that. My third question, Dr. Roussin, big picture. Manitoba now has the highest infection rate, daily infection rate in Canada by far. Winnipeg Health Region and Southern Health is now competitive in the negative sense with anywhere in the Western Hemisphere. What do you have to say about that situation?
Well, I think it's what we've been saying and what we said today is we've left with no choice but to put further restrictions in place. And so that's what we've done this week. We've now added Southern Health to that for those very reasons. We're seeing that the trend certainly going in the wrong direction, despite being in the orange level, and so we required these restrictions. And so as we continue to watch these, there's other areas within those restrictions that we may have to further restrict, and we spoke about faith-based gatherings. If we see any ongoing transmission, or more transmission that's linked to these events, then we may well have to further limit that. And so you're right, it's the trend's been in the wrong directions, but that's why we've acted this week.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, I'd like a bit of detail in the Southern Health region. You had mentioned before, I asked you a couple of days ago about the rising numbers there. You said there was some community transmission and, of course, the outbreak at the jail in Headingley, which is part of the Southern Health region. Can you give us some more detail as to where you're seeing these numbers across this large geographic region?
Yeah, and so it is a large region, much like we saw, in Prairie Mountain Health, where we saw some, relatively focused transmission. So here, certainly the corrections cases are in the mix there, but we have seen a lot of community-based transmission, and most of it is in the Steinbach area. And so certainly there are a focus of transmission right now, but with the mobility of Manitobans, with the challenge that we saw sort of in Prairie Mountain Health to actually delineate a geographic area that makes sense, and also considering that much of Southern Health is already in the critical red. Because of the capital region orders, we decided to implement it at the regional level.
Okay, and you had mentioned this to Bart that you've seen some transmission cases tied to religious gatherings. A lot of people are wondering why, even with the reduced capacity, the 15% in the critical regions, why fairly large gatherings are still being allowed there.
So again, it's the capacity that's really important, right? So 15%, and so if you think about the size, the occupancy that must be accommodated to get anywhere near 100 in there, we have a lot of spacing, and so I like any of our restrictions, nothing is complete. We're going to continue to look at that. You know, when we look at the things that are still operating in the capital regions, faith-based gatherings, we still see, you know, we still have tried to keep the gyms open for, you know, for obvious beneficial reasons, non-essential retail, things like this. So these are all things we're continuing to review. And so we still have ways to move if we need to get more restrictive. But right now, that's where we wanted to leave that balance.
And final question, when you started off today, you talked about some frustration that you saw some premises trying to work around orders and people still planning gatherings of some sort. Are you a bit fed up? Are you a bit frustrated?
Well, no, I mean, I think it's just the, you know, it's not it's certainly not about me. I think with public health, when we're seeing the numbers climb like this, and we put restrictions in, and then to get, you know, questions posed from businesses that would, you know, end up in, you know, quite obviously missing the spirit of the orders, right? We're trying to reduce gathering, right? Our message to Manitobans right now is actually stay home as much as you can. So we, you know, there shouldn't be Manitobans right now looking at ways to further the ability to gather. You know, and we just have to work together. And of course, it's easy to say. These have profound impacts on, you know, on people's livelihood. And we don't take them lightly. We've never taken it lightly to implement these. We always look at both sides. We always look at where that balance is. But right now, you know, the message to Manitobans is we need to stay home as much as possible. And so despite how difficult this is, we can't look for ways around it. We can't look for ways to try to have Manitobans gather right now outside the household. So that's really our message from public health.
From CTV Winnipeg, Turia.
Good afternoon. Dr. Roussin, I just wondered if you could elaborate a little bit on the previous question about businesses trying to work around the guidelines. Do you have specific examples of how they may have tried to do that?
Well, so I mean, big picture, we know the group sizes are 5. For events, right? So something that's new, and so there's different businesses that might try to fit into other categories to try to get a wider array of people in. You know, we've heard of things like you know, even serving alcoholic drinks, you know, doesn't classify as food. So therefore, you know, places could operate still and have people inside. If they weren't serving the food, then that's not a restaurant. So it's just things like this. And again, it's understandable. I don't want to call out any individuals. That we can't identify any individual companies from this. It's not about that. It's just that we can't look for ways to gather right now. We have to stay home as much as possible, do the essential things. But those public health orders, they're clear. It's no problem asking to get clarification on them, but I think the spirit of them is very clear. The spirit is we can't have large gatherings, that we need Manitobans to largely keep to themselves now. You know, other than virtual meetings, you know, do the essential things. Home, work, essential tasks. But the spirit is, in the short period of time, we've got to interrupt the transmission of this virus.
We're also hearing from certain doctors' clinics rather, that there is a shortage of the flu shot. It might be anecdotal, but I'm just wondering, does the province have enough flu shots heading into flu season? And is that
Yeah, and so we ordered, you know, 20% more flu shot this year, and so there isn't a shortage. Of course, every year we distribute it to, you know, thousand locations. So any one location might be out, but we've shipped out the door more than 550,000 doses of flu shot. And so from our early reports, or just things coming in that, there's hundreds of thousands of doses available to Manitobans right now. So there isn't a shortage, although, at certain locations, they may have been very apt at getting that into people's arms, and that's great. But overall, there isn't a shortage right now.
And my last question is for Ms. Siragusa. I'm just wondering if you could elaborate on what would trigger a move into phase 2 in this COVID preparedness plan that was released today.
Well, it can depend on a lot of different things. Actually, there's not one specific trigger point. We would look at the rate of people coming into the hospital, where they're specifically going. If they're going the medicine route or they're going directly to critical care, that will trigger a different response as to which beds we're going to open up and which staff we need to deploy. So it's looking at a variety of factors, but it's also staff illness, if there are absenteeism. So depending on all those factors, we will put it together. We consistently, very regularly, multiple times a week, if not daily, if not multiple times a day, are meeting with our specialty leaders, our nursing leaders, and determining what the next steps are. And there is a big plan. It's just a matter of what happens when in the puzzle. So it's not I can't give a defined answer, but it's really clinical judgment and us responding to the situation as it happens.
From City News, Jonas.
Good afternoon, folks. Dr. Roussin, first question for you today. We are hearing concerns when it comes to testing over the availability of pipettes, I guess. It's the little tip on the front of what they use to, extract the samples. And we have heard a doctor tell us that he's concerned we could run out of those very quickly. What's your updated status on that, and how many we have in the city?
Yeah, so this is just the nature of that, of testing, right? And we've heard all sorts of things over this time, and it adds to the complexity of it, especially when we're doing 3,000, sometimes 4,000 tests a day. And so, all along the chain, we have the human resources, we need the swabs themselves, we need the viral transport medium, we need the reagent at the lab, the pipettes at the lab. And so I don't have specifics on this. We're definitely aware of an issue with the pipettes that's being worked on right now, and we're going to try to ensure we have enough of this moving forward. But it also goes to show that when we talk about a finite resource, it's just like anything else in healthcare. This is real. All of those things I mentioned are finite. There's not an unlimited supply of anything in any jurisdiction. And so when we do our testing, we should utilize it to the best capabilities we can. And that's why we've also called today to reduce the asymptomatic testing.
And just as a follow-up, sir, the big concern is that we could legitimately run out of testing supplies in the next couple of days. Is that, can you comment on that? Is that occurring, or is that maybe just a sense of maybe one place running low?
Yeah, I mean, there certainly is an issue with the supply. I don't think I would frame it that we'd be running out of the ability to test within a couple days. But nonetheless, there's finite resources with this. We know the reagent is always on that. So we have people working on it. We're going to continue testing, as advised. But we do want to limit the less important testing, and that's that asymptomatic testing.
Thank you for that, sir. And just as a question on, maybe not so much on schools, but the activities surrounding schools. I've heard you say, we've heard many times that transmission isn't occurring within schools. We're seeing cases in schools because of community transmission. When it comes to extracurriculars and things like this that have picked up because of school and because of that ability of kids to be together, is that maybe more of an issue than the schools themselves?
Well, we have seen that transmission in some of those things, and that's why we stopped recreational activities. So the sporting events, we saw a lot of transmission related to hockey, and it had mostly been within one team. We haven't seen a lot of transmission between teams. We saw it, on one team, and that's the bench, that's the change room. And so that's why we made those changes. We found that it's much more difficult to have control over that as opposed to the classroom setting.
From Reuters, Rod.
Yeah, just to follow up Bart's question earlier for Nurse Siragusa, at what point would Manitoba consider a request for doctors and nurses from other provinces on loan? Like, where would that fit into your surge plan?
I think if we saw an increase in the absenteeism of our existing staff, or we tapped out on our recruitment, that would be the next step. And we would be having conversations well before that. Again, it's just part of the preparation and contingency work that we are doing. I would say probably, though, that every province right now, their critical care teams are pretty valuable and may not be deployable. But there are other options as well. So it's certainly something I think there actually may have been some conversation. We haven't gone deep down into that, but we would look at options. So it really depends on the situation. But ideally, we'd have things queued up that we can trigger when we need to. And we're not close to it yet, but we certainly could find some support when we need it.
Thanks. That's it for me.
And that's it for today's media briefing. Thank you.